1 in 8 visits to the emergency department is related to a mental health or substance abuse issue. With the influx of ED visits and decreased capacity to manage patients with mental illness, these patients often have long length of stays while waiting to be connected with proper resources. They may also demonstrate agitation, leading to an unsafe environment for patients and employees. Exploring models of mental health care in emergency departments and assessing their effectiveness will be important to alleviate these problems. The study aims to explore whether the introduction of a mental health nurse into a community-based hospital ED reduces mental health patient length of stay and patient agitation. Starting January 2020, mental health nurses were implemented in the Good Samaritan Regional Medical Center ED to manage patients with a psychiatric chief complaint during specific shifts. Data was pulled from the hospital's electronic medical record for ED visits between January and August 2020, where patients required a psychiatric evaluation. We compared patient and encounter characteristics, ED length of stay, and need for de-escalation medications and restraints across encounters that had and did not have documented support from a mental health nurse. Overall, 384 ED encounters were included. 152 of them had documented support from a mental health nurse. The top graph shows that there was increased medications for de-escalation ordered, as well as increased restraint use with mental health nurse support. There was also increase in discharge to home with mental health nurse support. The bottom graph shows that there was a longer length of stay in the ED with mental health support. In reviewing these results, longer ED length of stay with mental health support may be associated with the nurse being assigned to patients with more acute psychiatric conditions who required longer ED stay. It may also be due to increased knowledge of resources available for patients with mental illness, leading to increased time needed to connect patients to these. The increase in the use of de-escalation methods may be due to the nurse's experience, as they have more training in assessing patients with mental illness and their needs and utilizing de-escalation interventions to improve quality of care. Further investigation is warranted to determine whether the implementation of a mental health nurse in the ED impacted workplace violence.